El Dr. Shah es un especialista en enfermedades cardiovasculares y el fundador y director de Apex Heart and Vascular Care. Tiene 7 certificaciones de la Junta en Cardiología y Cardiología Intervencionista. El Dr. Shah ha sido nombrado el mejor médico en la edición 2015 de Leading Physician of the World y ha estado entre los mejores médicos de Nueva Jersey desde el 2015. Recientemente apareció en Headline sobre inteligencia artificial y AFib. Para obtener mayor información sobre el Dr. Shah, visite la página www.apexheartandvascular.com.
To answer the question, there are 3 main areas where we can focus on. Number 1, to take care of your heart. Number 1, control your risk factors. And I'm going to go over in more detail what are those risk factors, but control the things that leads to heart disease and circulation problem. Number 2, don't ignore symptoms. If you're somebody who has any symptoms, get checked right away. Okay, so that's called early detection. Early detection is the key. Oftentimes, heart disease, the difference between a good solvable heart problem and a very difficult problem that you can never solve is timing. In heart disease, minutes means muscle. So that's the number 2 tip, that do not ignore symptoms. And number 3 is screening. Even if you don't have symptoms, if you have certain risk factors, then by all means get it checked. Once again, prevention is better than cure. So to answer the question, there are 3 things you can focus on. Control your risk factors, do not ignore symptoms, and get checked. Most common, obviously, being diabetes. Diabetics oftentimes have a heart problem, and the risk of getting heart problem in diabetics is 2 to 3 times higher than somebody who's not diabetic. High blood pressure, high cholesterol, smoking, overweight. If you have a family history of heart or circulation problems, stents, bypass, angioplasties, stroke, any of those factors, your risk of getting heart problem goes very high. Same way, if you have family history of varicose veins, family history of someone having circulation problems, blood clots, somebody in the family ended up getting amputation of their toes or amputation at the knee level, or someone had blockages in the leg arteries or kidney arteries, same factor, your risk also goes significantly higher. So again, family history, smoking, blood pressure, cholesterol, diabetes, those are the 5 big ones. In addition, we also know there are certain other risk factors that people don't think about, but a very stressful life, which unfortunately most of us have a very stressful life recently. So stressful life plays a big role. Sleep apnea, if you're not getting enough oxygen at night and you're snoring, that becomes a major risk factor. Sedentary lifestyle. If you have a lifestyle that doesn't involve much of exercise, and it's very relaxed and you're not doing a lot of physical activity, that does become a risk factor. So what are some of the symptoms? Chest pain obviously is being one of them, but people can also have other forms of symptoms, including shortness of breath, that is very unusual, feeling dizzy, lightheaded. Some people can have symptoms of unusual palpitation, that they feel like their heart's racing, going out of control. Same way, leg problem and circulation problem can come in a lot of different ways. It can come as pain, it can come as cramps, discomfort, achiness, it can come as dull ache, or it can come as sharp pain. Some people will have discoloration where legs have blue-black spots, they have varicose veins. Sometimes it comes as Charlie horses, that at night when people go to sleep, they get this restless leg syndrome. Sometimes it's just the swollen legs. So all these things could potentially be heart problems. So the way to take care of a heart problem is recognizing that this could be a symptom of heart, and talk to your doctor, talk to your healthcare provider, see a cardiologist if needed. So prevention is always better. Prevention requires controlling your risk factor. If you're diabetic, make sure your A1C is in control. A1C is the average 3-month blood sugar. Cholesterol, very important. People look at total cholesterol. Your LDL, which is a bad cholesterol, is truly determinant for blockages. So that should be nicely in control. So controlling risk factor is number one. Number two is exercise on a regular basis. These things can help determine, if you're getting symptoms, you would know early on. And B, it will prevent you from getting major blockages. Even if the arteries are blocked, more exercise you do, you tell your body to form new blood vessels. So exercising can prevent all kind of problems. And number three, as I said earlier, get it checked. A lot of times these problems are minor at the beginning. And if you take care of them early on, it's easy to fix, nothing to worry, and the problem solved. And if you don't fix it right away, it can get much worse as time goes on.